Hi, class. I just wanted to reach out and talk to you guys. I know a lot of you guys have anxiety about doing online learning for your first semester of the PA program. Um, the faculty have worked very hard to put together a plan to get you guys the learning that is appropriate to where you will not miss any program outcomes, that you will fulfill objectives of courses. We are being a little creative with some of this, so all faculty should have reached out to you by now regarding their course. Um, like I already described in an email, faculty should have put their plan of action for implementing online learning on your Blackboard page for each course. Also, all communication with you guys, the faculty have been instructed to utilize Blackboard announcements. This is because we want to keep documentation of how often we communicated with you guys, as well as kind of a checks and balances to make sure no courses are being overlooked or not appropriately taken care of. Anatomy is probably the course that you are all most worried about. Doug Urban has some pretty good ideas for it. He's already started implementing. Um, um, he has done voiceover for his PowerPoint lectures and have posted them. Um, he's already has a pretty large Blackboard presence, already has many things on there for you guys to utilize that you would have utilized regardless of whether you were on campus or from a distance. Tests will now be online. I believe today was your third anatomy written exam. You had your third practical exam last Friday, which we appreciate your willingness to get that taken care of before you were all forced off campus. I do know he plans to implement some additional cases to just keep you guys thinking, applying the knowledge you are gaining from the PowerPoints, as well as all faculty were instructed to provide additional assessment processes within the course. So we could make sure that you are listening / reading the PowerPoints, studying the material, and continuing to prepare and learn the material. As program director, my biggest fear is that you guys will have all this time off and not be actually retaining any information and will negatively affect your summer semester as well as your final exams. So the additional assessments, like if they throw in questions in PowerPoints or maybe they give you a quiz here or there, points will not be allotted to those assessments. Those assessments are specifically in place in order to ensure that you are studying the material and that you are diligently trying to retain the material and you are constantly staying on top of each task and you're not waiting till the end and basically cram for an exam. Doug and Chelsea's physical diagnosis course, I know they have plans implemented to same thing, voiceover PowerPoints, additional resources in regards to videos and things for skills, and your practical exam will actually be completed. The intent is for you to create a video and then post that on Blackboard in an assignment folder. So more information on that will be to come. Doug is getting some of that stuff underway. Still working on a few things. They're working with SimCenter to get some of these skill videos completed. So be patient, okay? This is all new to us. This is uncharted territory. None of us have taught online before. This has always been a face-to-face program. So now basically converting a whole semester to online learning and the potential, God forbid, of it being extended into summer. This is new, uncharted territory. some things cannot easily be converted, like PowerPoints, for example. They can easily be converted. I mean, it is very easy to add voice to PowerPoints. But when we have to create videos of things we would normally show you in person, this does take time and does not happen overnight. So please be patient. Ron's classes, it sounds like they're in pretty good shape. He is adding narration to PowerPoints. He stated that he has provided you guys a summary week by week for each class. He has also provided some guided questions to kind of help you and also implemented some assessments. Pay attention to his course. Research, for example, usually you would present your research projects. So please stay tuned for updates in regards to presenting your research project via virtual conference. Something to add about Dr. Urban's classes, because he also teaches cardiopulm. We are working and trying to, the respiratory therapist that was supposed to provide you guys some teaching, we are trying to work with him to still provide that teaching. Unsure of the modality which will be used, whether it will be a live feed or if it will be a video recorded lecture or something else. But this particular individual is very tech savvy. He already has a pretty decent presence on YouTube. So I am confident that they will figure out a way to still get you all that important lecture material. Please do not hesitate to reach out to your advisors. If you have any concerns, questions, advisors will be reaching out to you all again, probably over the next few weeks, trying to see how you are, make sure that you are navigating online learning well, that you are not having any struggles, and that your anxiety is well within control. During this time, we are going to be patient with all of you as you have been patient with all of us, and we will just continue to work together as a team, and we will make the best of what we can. I did want to touch on a few things in addition. Your skills in physical diagnosis that you are learning, those physical exam skills, those hands-on learning, we do incorporate them into PASS 626 in the summer and PASS 636 in the fall. They are incorporated into OSCEs, but we have already had discussions of making skills a little heavier in these two courses to make sure, one, you were able to know how to do them, and also so that we can verify assessment-wise that you are on track with your skills. So keep that in mind. Also, anatomy. We know that you are very concerned about missing out on gross anatomy. So Doug is working with Dan to try to get you guys able to be up in the cadaver lab, still dissecting. It might take be a little bit different of a picture. You will still get gross dissection, but you may not be able to dissect the whole cadaver or whatever parts you hadn't yet. It may just be a particular area, which it'll kind of be a show and tell for the other groups that are dissecting other areas. This is still evolving in what it's going to look like. You will not be graded off this portion, and gross dissection will be not be required. It will be recommended, but it will be, you know, you decide whether you want to participate in this or not. It will be additional instruction, not be part of one of the summer courses, unlike the skills. So keep that in mind. We are trying to consider you guys' concerns, your wishes, as well as making sure that there is no lack in your learning outcomes. So I hope I've been able to answer a lot of questions. I hope I've been able to ease a lot of tension, anxiety. I am willing to do a live Zoom for anyone who may have questions So please contact TJ if you would like a live Zoom. Faculty have also agreed to join in on the live Zoom if you would like to talk to them. And hopefully moving forward, we will be back during the summer, and you as students and the program will not miss a beat. So that is our hopes, that is our intent. So work with us, be patient with us so that we can actually be successful at this. Thank you and enjoy your spring break.